Sildenafil, commonly known by its brand name Viagra, has become synonymous with treating erectile dysfunction. However, its uses extend beyond just that. In this comprehensive uses of sildenafil, we'll delve into the various aspects of sildenafil, including its uses, the primary use of sildenafil, and how it's prescribed to men who have difficulty achieving or maintaining an erection sufficient for sexual activity. It's important to note that sildenafil is not an aphrodisiac and requires sexual stimulation to be effective. Pulmonary arterial hypertension, PAH. Sildenafil is also used to treat PA, a condition characterized by high blood pressure in the arteries of the lungs. By relaxing the blood vessels in the lungs, sildenafil helps improve exercise capacity and delay disease progression. Altitude sickness. In some cases, sildenafil has been used off-label to prevent and treat altitude sickness, particularly in individuals ascending to high altitudes rapidly. Effects of sildenafil. Erectile function. Sildenafil has been shown to significantly improve erectile function in men with ED, leading to increased sexual satisfaction and confidence. Blood pressure regulation. While sildenafil primarily relaxes blood vessels in the penis and lungs, it can also cause a temporary decrease in blood pressure. Individuals taking medications containing nitrates or those with underlying cardiovascular conditions should use sildenafil with caution due to this potential effect. Side effects. Like any medication, sildenafil can cause side effects. Common side effects include headache, flushing, indigestion, nasal congestion, and visual disturbances. Serious side effects such as sudden vision loss or priapism, prolonged erection, are rare but require immediate medical attention. Dosage of sildenafil. The recommended starting dose of sildenafil for ED is typically 50 mg, taken orally as needed, approximately 30 to 60 minutes before sexual activity. Depending on individual response and tolerance, the dose can be adjusted to 25 mg or increased to 100 mg. It's important not to exceed one dose per day. For PA, the dosage of sildenafil is higher and usually administered 3 times daily. Conclusion. Sildenafil has revolutionized the treatment of ED and has proven to be effective in improving erectile function and enhancing quality of life for millions of men worldwide. However, it's essential to use sildenafil responsibly, under the guidance of a healthcare professional, to minimize the risk of side effects and ensure optimal results. If you're considering sildenafil for ED or any other condition, consult your doctor to determine the appropriate dosage and discuss any potential risks or concerns. Message ChatGPT. ChatGPT can make mistakes. Consider checking important